Welcome, everybody. I am Elizabeth Hamblett. I am the author of 7 Steps to College Success, a pathway for students with disabilities. I'm not very good at this. Let's see how that goes. And as part of my job at a university disability services office, one of the things that I do is I review documentation that students submit when they request accommodations. If you are watching this live, all this week on this Facebook page and on my other social channels, I am putting up all sorts of posts about the accommodations process, how students get accommodations, what documentation or paperwork they'll need for that, what kinds of accommodations they might or might not expect there. So follow that here. And it's kind of a perfect week to host these friends of mine. And when I say friends, colleagues, people that I admire. So I have here today Dr. Karen Wilson, who does a lot of things. She is a neuropsychologist. She founded the Child Nexus Network. She is a podcast host. I'm thinking the only thing she doesn't do is sleep. And also Dr. Jeremy Sharp, who is the also a neuropsychologist, excuse me, and host of the Testing Neuropsychologist podcast. And I have just found these people through my work and love what they have to do. And they were nice enough to carve out an hour, no more, of their time to be with us here today. So, Karen, I'll just start with you. Just let us know a little bit about you. What got you interested in becoming a neuropsychologist? Tell us about that.
Absolutely. So, thank you for so much for having me, first of all, and glad to be here with you again. We've collaborated on a number of projects, and this is another instance where we get to work together. So, I'm a clinical neuropsychologist, primarily do work in pediatrics, individuals between the ages of 5 and young adulthood. And I've been doing that work for over 20 years. It's hard to believe. And I think my entry into neuropsychology came from my interest in the brain. I actually had planned to go to medical school. I was a life science major, had taken all of the biology courses, calculus, chemistry, physics, all of that. And then I realized that I couldn't stand the sight of blood. And so that was going to be problematic when you go to medical
be a doctor
school.
That way, yeah.
But I loved the brain. I loved understanding the brain. I took psychology as my elective and found this area known as neuropsychology, which combined the brain and behavior, and just fell in love with the field and didn't look back since that time. And so I carved out my own little niche in that area, started actually with dementia work, diagnosing Alzheimer's disease and mild cognitive impairment, did a rotation in pediatrics when I was on internship, and just loved working with kiddos and helping them find out why they're struggling and putting them on the path to thrive and achieve their full potential.
Awesome. And so if somehow you have missed seeing Karen, her Diverse Thinking, Different Learning podcast is something I subscribe to. I listen to all the episodes, so be sure to get subscribed to that. I'll try and drop the link in here. Jeremy, tell us about how you got into doing what you're doing.
Yeah. Well, it sounds like Karen and I have lived parallel lives in some regards with some diverging paths. But I also started out, wanted to be a pediatrician when I grew up, quote unquote, and didn't end up going down that path. I had a friend in high school whose father was a psychologist and got the opportunity to shadow him and see what that work looked like. And that really sold it for me. So I went to school, grad school, thinking I was going to do a lot of therapy. And then it turned out that I'm a really bad therapist. And it was really enlightening to figure out that there's another way to do psychology. And that was testing, neuropsych testing and psych testing. So I think it just works really well with my brain. I like the data. I think in another life, I could have been maybe like an engineer or an accountant or something. So, all the numbers, all the data, all the pattern recognition, and then, I get to pull it all together and do some writing as well. So that's how I ended up in this little niche that we have of testing. And I just want to clarify, though, for the purists out there, I am not a board certified neuropsychologist. I am
That's my
a
error.
regular psychologist. That's totally okay, who specializes in testing, just to make sure,
And
want to
that's totally
misrepresent.
my error. I didn't want to undersell you by saying that you were a psychologist. Not that there's anything wrong with that, but thank you. And you're my kind of person. That's why I like you. I like to make sure I don't overrepresent anything. So tell me though, too, Jeremy, and we'll start with you. What made you? I mean, all the people I know who do testing again barely sleep. So what made you decide to start a podcast?
Oh gosh, yeah. So I was at this point back in, I think it was 2014, maybe 15, where, I'd had my practice for several years at that point, and it felt like it was going pretty well. And I had a little bit of an itch to do something different, do something new. I was a little bored, I guess. And I knew that I liked teaching, but did not want to be employed by university or do an adjunct thing or really go that route. And yeah, I hired a business coach, and thankfully that person pitched the idea of a podcast. He said there are no podcasts in this space. It's another kind of venue to share some information and teach in a sense. And I said, let's do it, let's give it a shot. And that was back in early 2000, gosh, 17 maybe, when I finally got it all going. And yeah, 7 or 8 years down the road, 500 episodes. It's the best part of my week now.
500. Wow. Karen, you got to be getting up there soon.
Not close,
well,
but we're actually
approaching
200. Yeah, we definitely started later.
And so for the folks watching, if you're a parent and saying, okay, but Jeremy's, podcast is for other professionals, you will be surprised at how helpful the interviews are. I don't do testing either. Again, my position is to read these reports, but he speaks to prominent experts in the field, and it's really interesting to learn about processing speed. A frequent guest at Karen's, Ellen Broughton, who's appeared on a lot of podcasts I know, folks have listened to, has been there, and some people that I really admire are on there. So, go through, you can, scan through and see what kinds of topics he's covered, but I think you'll find it really educational. And Karen, how did you decide in your quote unquote spare time to start a podcast?
Absolutely. It's again this parallel between Dr. Sharp's life and my own. I actually did go the route of being a professor. I was a full-time professor for a while. I was doing my private practice part-time. Loved teaching, loved imparting knowledge and sharing that information. And during the pandemic, when everything shut down, we're getting so many calls at my private practice office with parents saying, I don't know what I'm seeing. They're watching their kids struggle with Zoom learning. Is this attention? Is this anxiety? What's happening? And at the same time, a few months prior, I was at a conference and I was sitting around with researchers who were listening to a talk on cutting edge research on dyslexia. And I looked around and I thought, this is such great information for parents and teachers to have, and not a parent or a teacher in the room, right? It was all shared with psychologists and neuropsychologists. And we know there's a delay in getting that information to the hands of parents. And so part of my reason for doing the podcast was to share information that we have as clinicians, as professionals, with parents, with educators, so that they could make better informed decisions on the support their kids need, whether they need an assessment, the type of assessment they need, when intervention isn't working, what are some alternatives, and just, again, sharing the resources that I had access to with parents and with educators. And again, that got birthed out of the pandemic, where people were asking, what is childhood anxiety? Why can't my kid access Zoom? Why won't they come out of their room? I've never seen them struggle with reading like this before. What is this? Is it dyslexia? And I thought we can answer all those questions for them and lead them to the resources and support that they need.
Wow. Yeah. I mean, it's interesting. I have another neuropsychologist friend who had said to me a long time ago that like the rest of the world was discovering executive functioning, 10 years after they had been talking about it. So I appreciate both of you for, bringing this stuff to a more general audience. So Karen, Jeremy started by correcting me and saying that he is a neuropsychologist, not a psychologist. I see people throw the terms, psychoeducational evaluation and neuropsych evaluation around interchangeably, but they're really not. So could you explain to people what the difference is?
Yeah, I think both assessments involve giving tests, administering tests. But the purpose of the evaluations, the scope of the evaluations differ. And I think the psychoeducational tests entail, really serve a specific purpose. And it's typically to identify the academic needs of students, right? Or identify cognitive processes that impact academic performance, whether that be reading, writing, or math. And really what the goal is to be able to support a child academically, to meet their needs, to understand, if they're struggling with learning to read, if they're struggling with writing, if they're struggling with some form of processing of math concepts, to be able to identify that and understand, the kind of support that they need. With the neuropsych assessment, and I will say it's not about the test, because some of the tests can be actually very similar and even identical to those given in a psychoeducational evaluation. With the neuropsychological assessment, it's less about kind of the test that you're giving and more about who's giving the test. So a neuropsychological assessment is given by a neuropsychologist. And a neuropsychologist it's a clinical psychologist and a clinical psychologist can also do a psychoeducational assessment. But a neuropsychologist has additional training in neuroanatomy, in neuroendocrinology, in behavioral neuroscience, in neuropsych assessment, and brain behavior relationships. And so as a neuropsychologist, I'm looking at the assessment process through a different lens. And so when we do an assessment as a neuropsychologist, it typically involves a greater breadth, right? A greater scope. We're also trained to look at medical diagnoses, medical injuries, head injuries, genetic disorders that present in a cognitive way. And so it's really the scope of the type of assessment. But, and again, with the neuropsych assessment, allows you to dig a little more broadly into different aspects. We might go deeper in terms of language processing, deeper in terms of executive functioning assessment. Not to say that a psychoeducational assessment couldn't involve those things, but I think one of the biggest distinctions is that a neuropsych assessment, again, is administered by a neuropsychologist, and within a neuropsychological assessment is a psychoeducational evaluation. Both serve the purpose of identifying areas where kids are struggling and identifying where they need support.
Okay.
Hope that makes sense.
Yeah. Jeremy, can you add on to that at all? Or add some flavor?
I don't know. That was a fantastic answer. Yeah. Yeah. I just want to acknowledge it's a tricky question to answer, I think, because the terms have really gotten pretty interchangeable in the general public, I think, because not many folks outside of the testing world know the difference. And so we'll get referrals from physicians or OTs or school, and everybody seems to just say, like, hey, you need to go get a neuropsych eval. And so that's been sort of the broad term that gets thrown around. And yeah, like Karen said, it's not like the tests are different necessarily in most cases. There's a lot of overlap, but it's how you're interpreting the data and what you're seeing in the data, and breadth and depth, of course. But it is hard to separate sometimes.
I think neuropsych just sounds more impressive to people. And I often find myself explaining, like, psychoeducational evaluation doesn't mean that your student is potentially psychotic. So I think, we throw these words around and you realize, there's a big knowledge gap. And if you are watching us on Facebook, put your questions for these folks in the chat. I have mine prepared, but they're here to answer yours as well. So
Elizabeth?
yes.
I want to just add one more thing, because I think oftentimes the bigger distinction is between a school-based assessment and the kinds of assessments that Jeremy and I do. Because I think when you have a publicly funded educational assessment, the focus is really to identify whether a student qualifies for special education services.
Yeah.
Whereas if you're getting, a private psychoeducational or neuropsychological assessment, our goal as clinicians is to really identify why kids are struggling, identify the profile of their strengths and weaknesses, and provide a plan to how to support them, not only at school, which is kind of the focus of a school-based assessment, but also at home and outside of the home.
And just to be clear, for those who are watching this who follow my stuff about college, you're going to hear all the time, oh, you have to go get a private evaluation for your kid for college accommodations. It's absolutely not true. And so I am sure Jeremy and Karen could use, an extra couple of hours to put together another podcast. They don't mind me, telling you don't have to go see them. There are a lot of good reasons to get a private evaluation, but don't let it be that because somebody's scared you into thinking that you need a lot of testing. What we are looking for is usually a standard psychoeducational evaluation, which is the cognitive testing, like the Wechsler Adult or Children's Intelligence Scales or the Woodcock-Johnson Cognitive, and achievement batteries, like the Woodcock-Johnson or the Wechsler Individual Achievement Test. So further testing with more assessments can be useful, but it's not necessary. And you don't necessarily anyway, I will not belabor that point. So Jeremy, what kinds of changes have you seen in this field over time?
Mm. Yeah, I really reflected on this. I think some of the biggest things I've seen, I just use COVID as a marker in time because it was such a distinct event, I think, for a lot of folks. But some of the biggest things we've seen have been just more awareness of mental health in general, especially in kids and adolescents, which is the population that I primarily work with. So we see a lot more awareness of mental health, a lot more willingness to acknowledge mental health concerns, maybe decrease stigma with mental health. But the flip side of that coin is that we've also seen a lot of self-identification with different mental health concerns. And, I don't know if you call it like the TikTok generation or what you might say, but, there's a lot of exposure to different diagnoses, right? And identification with certain diagnoses. And so we kind of wrestle with that as a field too, and how to affirm individuals and their experience and also balance sort of the clinical aspects of the diagnostic work that we do. So those are a few things that came to mind for me as far as biggest changes. Of course, increased incidence of autism and ADHD and things like that. Those just keep going up. But yeah, I'm curious what Karen may have seen.
Yeah, and I agree with you in terms of the mental health. It's more awareness and understanding and a willingness to provide support, right? I think the other biggest change has really been the shift from pathologizing a lot of differences in the way people are to really a more neurodiversity affirming approach. I think we've always known that, neurodiverse or neurodivergent brains exist and those brains work differently. People have differences in the way they think, the way they experience the world, and the way that they learn. And I think there's an increased awareness around that. But I've seen the shift in a greater understanding that the world that we live in is not designed for, neurodivergent brains. It's designed for neurotypical brains. And then with that understanding comes the understanding that we need to really adjust the environments that a lot of individuals live in, hence accommodations, right, to support these neurodivergent brains. And I think that's been a big shift. And it's kind of that move from seeing issues as a problem to understanding that mismatch between, the world that they live in and the way their brains are organized.
That's really interesting. Yeah, I mean, I agree with what you're both saying. There's certainly, the self-identification piece is becoming a little more complicated for us at the college level because we still require documentation. And so it's been interesting. Karen, do you think there's any misunderstandings about the work that you do?
There probably are a lot of things, a lot of misunderstandings.
Fair enough. Yeah.
One is that, the purpose of the evaluation is to determine whether or not, a person has a diagnosis. And, you might find out if they have a diagnosis when they do an evaluation, but at least for the way I approach it, it's really to seek understanding, to better understand why someone is struggling. And I think the stigma that goes with having a diagnosis actually keeps people from seeking out an evaluation or keeps people from wanting to release the report after you've spent 20 hours, with their family and writing the report. I think there's a lot of stigma involved. And again, the misunderstanding is that the whole purpose is to identify, find a diagnosis, and then label that person and have them carry that label for the rest of their life. And that's really not what our goal is. Our goal is to understand why someone is struggling, whether that's at school, whether it's on the playground, whether it's why they can't follow directions during, a soccer game. We want to understand so that we can better provide the support that they need in order to thrive.
Jeremy?
Yeah, that's well said. I have shifted over the years in describing what we do. The first thing I say now is we help people understand themselves and their family members better instead of trying to describe testing and everything that goes into that. I think also, people, this is related, but, people often come in thinking we're just going to, find out what's wrong, quote unquote. And I always like to emphasize with folks that, at least at our practice, I'm guessing Karen, y'all approach it similarly. We're like very strengths based in our evaluations. And so we're talking just as much about what people are good at and how to really emphasize and take advantage of those strengths, as much as we're talking about challenges and how to support those challenges. So as much as I can spread the word that we're not just going to, tell you what's wrong, we're going to help you understand what's going really well. So,
absolutely.
Are there questions that you find parents, students want answered that testing can't answer?
For me, it's often like, why is this? Why is my child dyslexic? Why does my child have ADHD? Okay. And often we don't have an answer. There is no definitive answer as to why that is. And that's one question that we often cannot answer.
Interesting. Okay, Jeremy, any
thoughts
on that?
Well, that's validating to hear you say that. Yeah, I mean, I think people come to us thinking they're going to have all the answers and the why, and I feel so I can't think of the right word, but it just like I'm not giving them the right information. I feel like all the time I'm just saying, well, it's some combination of genetics and environment.
Right.
That's basically what causes everything, so to speak. And it's not the concrete answer people are looking for.
I think that's interesting. We talked about public versus private testing. Have you guys ever referred, potential clients back to the school district and said, actually, the school can answer this for you, or I'm not, this isn't the right fit? Karen?
Yeah, I mean, I have, especially when people are calling and just inquiring, sometimes they haven't even asked the school for an assessment. And, why not start there? Because especially when, again, there's this very specific scope in terms of what they want an answer to, right? Let's start there. I mean, it doesn't mean that later on they don't have a private assessment or they have something more comprehensive, but that if they haven't even approached the school or they didn't know that the school could do an assessment, then I will often say, why don't you start there? Particularly if it's very specific, it's a very specific question about reading or about writing or about math. It's in the academic realm. It's not impacting their life outside of school. Then I'll often say, at least start there, particularly if they have never even approached the school about the possibility of an assessment.
Jeremy?
Yeah, completely agree. Yeah, especially if they're presenting specifically for academic concerns. And, there's an added layer for us as far as the financial component, and that insurance does not pay for an academic focused evaluation in most cases. So it's a lot more advantageous for them to just go through the school where it's free and, they can get a lot of those answers. Now, if folks bring more concern about let's just say more complex concerns that go beyond academic, then we, of course, will talk with them about the differences and what we might be able to provide that the school cannot. But certainly happy to steer people there.
There are things that the schools are just not set up to do, and that's not the fault of the people who are working there. That's the way things go. And again, a reminder, I see you folks watching this on Facebook. If you have a question, I've got mine prepared, but I'm happy to feed them your questions. So just put them in the chat. Jeremy, can you talk a little bit? I know you just said you don't do this anymore, but I'm going to ask you, can you describe, give people a sense of, if their student has never been evaluated and they know nothing, like what kinds of things does an assessment what do the tasks look like, or, so that they could sort of reduce the anxiety for their student. Because I think that novelty can be, worrying.
Mm, yeah, yeah, of course, of course. So we always start every assessment that we do with some version of the phrase, some of these things will be really easy and some of these things might be pretty difficult for you. This is a standard line that we use. It's in the instruction manual for, one of our very, well-known tests. But there's a lot of truth to that. And so I tell people that right off the bat, we're going to cast a really wide net in most cases to see what your brain is up to. And some of those things might be hard. Some of them will probably be pretty easy and maybe even fun. But also tell people that, people come in with the misconception that we're just going to set them up on a computer and it's going to be like standardized testing in schools for 6 hours. And I make sure to tell them that's not the case, that it's very interactive, that we're going to do a variety of activities, like word games and memory games and, things that look like puzzles, and we'll ask you questions about yourself. And the majority of it is, engaging and back and forth. And it's not just an independent task, that people, we're going to set them up in the corner and let them go by themselves for hours.
Karen?
Yeah, and I completely agree. I think we have the same script, Jeremy. What we say. And then I think in addition to the testing that we both do, part of the assessment process, about that child's history, because all the tests we interpret within a context of that family, and in the context of their birth and their delivery and their developmental milestones, whether they were met on time, whether they were late in walking and talking, whether they had early intervention for speech and OT, and also having conversations with teachers, because we're not in the classroom with these students, and the testing sessions that we do are ideal. They're optimal for students, even those with attention issues, because it's one-on-one. There are very few distractions, and it's an optimal learning environment. And that's very different than a busy classroom with 22 kids, sometimes 30 kids. And so we need input from teachers about what is happening with that student in the classroom, in that larger classroom. And that comes from speaking to them, having phone conversations with teachers. It may involve a school observation, going and sitting in and observing the child, and also having the teachers complete rating forms. We have parents complete rating forms as well. So we know, are the things that they're observing typical for a 13-year-old girl, typical for a 6-year-old boy, or are they reporting more problems than we would typically see? And so we take all of that information, in addition to all the work that we do one-on-one with the student, put that all together to get a nice picture, again, like Jeremy was saying, of the child, of the young person's strengths and weaknesses and areas, and help, again, to identify those areas where they might need support.
I mean, I'm so pleased to hear you talk about getting outside information. I read dozens of reports a year, and so rarely has the examiner, is the word we use at the college level, at least in my office, like the person who did the report even sought any third party information. And when it comes to these older students, especially when they presented for testing for the very first time, junior year of high school, and there's no evidence that they've had any struggles. The grades are all supposedly very good. And, it raises questions about why this student is coming. And so, if they say, I'm slow taking tests, I would like to see the examiner talk to the teachers and say, oh, yeah, all the teachers said that Elizabeth, can answer all the questions in class, but then when she takes the test, she's not finishing. So, folks, I have two blog posts, which I will attempt to put in the chat here, but if not, I'll do it later, about what you should be looking for in an evaluation. What kinds of things these folks should be expected to be including: a thorough history, lots of details, meaningful analysis, all the stuff that Jeremy and Karen are talking about. So we have a question. We have somebody who said, that their daughter, she tried to get the daughter assessed for autism twice, and the write-ups that they got back are problematic. One quote is that she's the most delightful kid we ever interviewed. She can't be autistic, or um, instead of being called autistic, there are euphemisms like social pragmatic disorder. And so this parent, I think, feels that the people that she's taken her daughter to do not have kind of an updated understanding of autism, I guess, and wonders how can she figure out who has updated assessment skills, which is an interesting question. So Jeremy, you want to start us off?
Oh gosh, I was hoping you'd ask Karen to start. This is a tough question. I mean, so of course, the first audience question is wading into one of the most complicated, fraught areas of our field right now, which is diagnosing autism in women and girls and female identifying individuals. Yeah, yeah, it's a tricky question. I mean, I'll take an attempt and then we'll see where we go. But if the question is how to find someone who is updated and in tune with the latest research and practices, I mean, asking, I know it sounds very straightforward and simple, but just being very direct with the practitioner. We get that question a lot. Are you familiar with autism in girls and women and what that looks like and how it might be masked and so forth? So does not hurt to ask. I mean, of course, perusing their website and materials to see if they explicitly mention that area of expertise, or just, I think, like Karen mentioned earlier, the term neurodiversity is maybe a signal that clinician might be more in tune with sort of progressive assessment and neurodiversity affirming assessment. So those are a few ideas just off the top of my head, but I hear this story a lot, actually.
Didn't mean to put you on the spot.
No, and
it's all good. That's what I mean.
I would completely agree with everything that Jeremy said, because it really means that you need to speak to the clinicians and find out what is their experience assessing for autism in girls, autism in women, if you're, looking for an adult seeking an autism diagnosis. And so definitely agree.
So I have mentioned that I, have my own thoughts on what should be in a good evaluation. But, as we're talking about looking for somebody to do this, Karen, what are the kinds of things that you would suggest? I realize, often people are just looking at websites or directories or getting, recommendations from their friends. Is there anything else you think they could do to find somebody who's
I think those are good places to start in terms of doing your own research. And I have a lot of families who get referred to my practice from other families who've had evaluations done, right? And so they were happy with the process and the outcome and the recommendations. So I think those are good things to look for in terms of getting a referral from a friend. But then I think also asking what their approach is, and in all the things that Jeremy and I both shared in terms of what that assessment process looks like, and getting a sense, you should get a sense that the assessment is not something that is going to be done to your child, right? Or done to your team. They should feel like this is a collaborative process that we are going to, together, we're going to better understand why your teen is struggling, and recognizing that the parent, the child, the teen themselves are really an expert in their own experience and their lived experience. And so validating that experience is going to be really important. Can you hear that from the clinician, that that's happening? And that it is going to be a collaborative process. It's not just going to be, we're going to administer these tests and then I'm going to form my conclusions. No, I'm going to gather information from you. Right. I'm going to ask you, does this seem to make sense? Have you experienced this struggle as well? I'm going to ask you, what do you want out of this process? Because I'm going to want to make sure that what my thought is in terms of, why you're seeking this process is consistent with what you want, right? And so, again, the collaboration is really key. Are you hearing that? Like Jeremy was saying before, or do they have this kind of neurodiversity affirming approach? And then also asking questions about what to expect after the process is complete. I think that's really important, because the assessment is only as good as its recommendations. Because at the end of the process, if the end result is you get a diagnosis of ADHD or you get a diagnosis of dyslexia, the question is then what? What do I do? Not only what are the accommodations and modifications in school, but what can I do as a parent to support my child at home, maybe on the playground, depending on what the findings are. But again, that should be part of the process. It doesn't end with the assessment. The actual testing is only part of the assessment process. We have to have recommendations that are going to be helpful to families. And so asking questions about what can you expect after the assessment is complete?
Mm-hmm.
What kinds of recommendations have you made? Have you made recommendations for individuals, who are seeking those services through their insurance company or through the school district because they may not have the funds to be able to hire a private educational therapist? And so asking those questions are really important.
Jeremy?
Yeah, I love that. The only thing I would add is maybe to just emphasize what Karen said earlier about the comprehensive nature of the eval, and a good evaluation should incorporate all kinds of sources of information. They should be talking to the teacher. I love doing school observations. They should be talking to, just getting information from a lot of different sources versus just meeting with the kid or just meeting with the parent. I just want to say that's very important and not always the case.
No, not. I mean, as a receiver and a reader of all these reports, it's really not the case. Oh gosh, I had a question on the tip of my tongue. We're talking about getting Oh, so some things I don't think it'll be controversial to say that I observe. Um, the report should be signed. It can be auto-signed, but I've seen unsigned reports. It should be on letterhead indicating where this person's office is. There should be a license number to show us, at the college. I know you guys are laughing. Oh my goodness, the things I see. It should be proofread. Everybody makes errors, I get it, but sometimes the scores that somebody has in their score table don't align with what the examiner is talking about in the narrative. So, time saving measures like templates are great. But these folks are getting paid a lot of money to do these reports, and there should be a level of professionalism that I think families should be able to expect. So, have you ever had a situation, Jeremy, where you did, the family really thought the student had a disability and that was not what your finding was? And so, how did you talk to them about that?
Yeah, that comes up occasionally, I would say. And I don't know that it's a black or white thing, like they thought something was going on and we thought nothing was going on, but we often get the case of it's a different something, right? So folks may come in thinking, oh, this is a clear case of ADHD, I'm convinced my kid has ADHD, and let's figure out what to do about that. And we might say, well, this seems to be driven more by anxiety and a pretty significant reading issue, and so they're, fidgety and not paying attention during reading in class or something. And those can be hard conversations at times. To me, though, I really emphasize with parents or individuals that we can validate their experience and provide helpful recommendations without necessarily agreeing on the diagnosis, if that makes sense. Of course, I want to make sure that we go through this collaborative process and understand what's happening for everyone and take all the, the information into account. But again, just trying to say, I totally see this, and these things are happening. It's maybe just not driven by what you thought was driving it. And we can still talk about helpful recommendations, and we'll make sure to support your kid. And I'm not going to just cut you loose because we don't necessarily agree on the diagnosis. But that's how I approach it. I'm curious how.
Yeah, and I agree. And I think that, again, when parents come in and families come in, and the individual themselves, they want to know why they're struggling, and oftentimes explaining, because sometimes people come in with this preconceived notion of what ADHD is. Oh. And then when you explain it to them what it really is, then they realize, oh, okay, so that's not consistent, or it is consistent, or they thought I do not want you to tell me that this is ADHD. I want to do the evaluation. They'll have the reverse, but I do not want to hear it's ADHD because I don't want to put my kid on medication. Oh. And then you share with them, well, in fact, it is ADHD, but let me tell you what ADHD is and what it's not, because some people say, well, it can't be ADHD because he can play video games for hours. And it's a misunderstanding about preferred versus non-preferred tasks. Mm-hmm. And so oftentimes part of the process, again, is explaining and sharing information about a diagnosis if it's there, and then also why a diagnosis may not be there. Because typically when you have a diagnosis, it's because you have characteristics, traits, symptoms that are interfering with your ability to, complete daily tasks, right? It's interfering with your ability to access the curriculum at school, to, participate in activities that you need to do at home. And so you can have attention struggles and not have ADHD because it's not impairing you in your environment. And so, again, describing that to parents. So you're validating, yes, I'm seeing attention issues too, but they're not significant enough to warrant an ADHD diagnosis. That doesn't mean that there aren't things that you can do to support a child who's struggling with attention. But again, you're giving them some recommendations as well. So it's not just, well, it's not there, see you later. We're seeing some of these characteristics. It's not clinically significant, but here are some things that you can do to support your child.
That makes sense. I used to work with a neuropsychologist, and I used to do the achievement testing because that was what I was qualified for. And he used to say, even it's not always a disability, but there's a reason people came. Something's going on. It may not rise to the level of being a disability. That is so interesting about them asking you not to diagnose something specific. I had not thought about that. Karen, and then we'll wrap up. And last chance, folks, if you've got questions, put them in the chat. Have you ever had parents, specifically, I guess more so than students in my mind, but you'll correct me if I'm wrong, come to you for an evaluation with very specific accommodations in mind that they would like for you to recommend?
It's usually with the older students, right? It's usually with the older students, and oftentimes that's because they've had those accommodations before, and they want to keep them, right? So this might be someone who had an evaluation done when they were in third grade, fourth grade. Now they're having a reevaluation done for high school, and they want to keep those accommodations. So they will come in saying, my child has a reader, they get 50% extended time, they get preferential seating. And so they want to ensure that their teen will continue with those accommodations as they're transitioning to middle school, as they're transitioning to high school, or as they're transitioning to college. So that's usually the case where they come in with what they want those accommodations to be.
And have you at times had to say, actually, this doesn't, it's not relevant anymore. It's
what I will say even before the assessment begins is that I cannot guarantee that this assessment will show that your child needs these accommodations or qualifies for these accommodations. Because just because you're doing the testing, doing the assessment doesn't mean that your conclusion will be that they will need 50% extended time, or that they will need to have, all of their reading data transcribed. That may not be the conclusion that we find. And even if we request that, it doesn't mean that they're going to get it. So there's a couple steps that need to, because I've had, a call recently where I made recommendations for a university student, and the university will not provide. Difficulties aren't significant enough to warrant those accommodations. So I think you have to be really upfront with parents and with teens to say, we can do this process, but doing this process does not guarantee that you will get the accommodations that you're seeking.
And that shouldn't be the expectation, right? That because you paid for an evaluation, it will result in certain outcomes. Yeah. Jeremy, you want to add on to that?
Yeah. I call it the golden ticket. I always tell folks this evaluation is not a golden ticket to everything that you might want. The one that has come up just recently, which I think you even write about in your book, Elizabeth, is the single room at college. I've gotten a couple of those, maybe 3 or 4 of those here in the last 6 months or so. And I always tell families like, hey, I will go to the data and I will go to the research, and I will, go to bat for you based on what I find if it supports the accommodation. And if not, I try to be pretty straightforward and maybe brainstorm some other options or ways to, support their student. And, in the case of, times when an accommodation may no longer be relevant or supported, I try to spin it and say like, hey, let's look at this as a positive. Like your student has grown or advanced or learned enough that they don't need this anymore. And isn't that a great thing? Like the intervention has worked, or the maturing has worked, or, whatever it may be. And it can still be a hard conversation sometimes. But.
That raises a good question, which is, sometimes when I say to people, you may, and I think Karen just gave this example, you may not be found eligible at college, and they say, well, learning disabilities don't go away. And, but it is true, I believe, that over time, if you've tested somebody very young, there can be improvements in skills and, cognitive development that, don't show that the student still has a substantial limitation. Is that correct?
That is correct. And particularly, I mean, I've tested kids when they were really young where they were, 2, 3 grade levels behind in reading, and then see them again in high school and they're at or above age and grade level.
Right.
And you have to, and like I agree with Jeremy, that is a huge success story because of where they came from and where they are now. But, there's also comfort in knowing that you have this accommodation. So there's sometimes reticence about, not having this when you need it. And oftentimes if you push a little bit, the students themselves will say they have the accommodation, but they don't use it, right? But they just like to know that they have it in their back pocket if they ever need it.
That makes sense.
Yes.
Jeremy.
Yes, it's an interesting dilemma. It really is, just around, do we want the intervention to work, right? I mean, that's
right.
But then also feeling maybe disappointed or like we're missing something if we don't need that accommodation anymore. Yeah, it's a tricky subject.
So we're going to wrap up. So I have dropped your podcast links and your practice links in the chat here, but is there anything else you want to say, Jeremy? We'll start with you about how people can get in touch with you.
Oh, sure. Yeah, the best way is probably through the podcast, which is called The Testing Psychologist. Like you mentioned, there are, I think, a few interviews on there that might be relevant for non-clinicians, just from subject matter experts. But yeah, super easy. It's Jeremy at thetestingpsychologist.com, and happy to chat with anyone with any questions.
And if they want an evaluation from you, contact your practice.
Yep, our practice is the Colorado Center for Assessment and Counseling. It's coloradocac.com.
Okay. And how long is your wait list right now?
Oh, why'd you have to ask that? Yeah, so
I'm so sorry. I've screwed up this interview big time. I apologize.
It's all good. No, it's all good. No, full disclosure, we got to be transparent. Yeah, so our wait list, it takes about 6 months to get in to start the evaluation, and then it usually goes pretty quickly from there. We wrap it up in 3 to 4 weeks, but yeah, it takes a little while to get started.
Right. And Karen, how long is your wait list?
Right now we're scheduling to November right now.
Okay, September, October. So that's only 3 months.
Only 3 months away. My private practice website is West LA. So it's West LA Neuropsychology. The website is westlaneuro.com. And then for additional resources regarding, learning differences, learning disabilities, neurodivergence, they can go to childnexus.com and also subscribe to our newsletter. We send a lot of great information about resources and support for parents, educators, and young people themselves. So there you go.
Well, thanks to everybody for watching. Again, if you have friends who are not on Facebook, tell them to look for my YouTube channel in about 2 weeks, and this should be up there. Thanks, everybody.
Thanks for having us.
My pleasure.
Yeah,
thank you for carving out time. I can see how busy you are.